Good morning, everyone, and thank you for joining the Safe and Affordable Fund for Equity and Resilience program, also known as SAFER. The webinar series this morning is Identifying At-Risk Public Water Systems. It's the second part of a series. We held the first one back in April, and we also want to say that there'll be a second webinar this afternoon on State Smalls starting at 1 p.m. You can still register for that. Just want to let you know that this meeting is being held virtually and it's being recorded and webcast publicly. You can go to the Cali PA website and join us there if you want to listen, but we are also having an online discussion in this meeting and encourage you to join via Zoom if you'd like to be a part of that. Before we get started, we just want to take a moment to honor the groups who have experienced economic, environmental, and social disadvantages as a result of historical marginalization. This is a large reason for programs like SAFER. We recognize that we're meeting during a very challenging time and that the impact this global pandemic has had and will have on marginalized communities and many people on this call. Our work here today is a reminder that it's especially supposed to support Indigenous and community voices as we all work together to provide clean, safe, affordable water for all Californians. We want to thank each of you for finding a way to join us virtually, and we thank you for your patience and understanding as we quickly have moved to 100% virtual meeting space in just a few short months. But we want to make sure that we're adapting to the needs of this pandemic and that we can still have active participation. We're doing our best to make sure that everyone can participate in an effective way and that our time today is valuable for you. We don't anticipate any delays, but we're asking for your patience in advance if any difficulties should arise. We'll fix them. We have a big team working behind the scenes to make sure that everything goes smoothly. So some guidelines for our meeting today are, if you're joining by Zoom and you only want to listen, you don't anticipate wanting to be part of the discussions or asking questions and you just like to listen and hear what's going on, we ask you to jump over to our webcast channel. That's up at the top. And that way we can increase the capacity of our Zoom platform, which prevents any technical delays. If you are joining by Zoom, which you're encouraged to do, we ask that you mute yourself if you're not already muted. You can take breaks as you need them, and then that you submit your questions or comments for the discussion pieces in the link provided here. It's the bit.ly @risk2-am link. That was also sent to you as a link in your email packets last night and this morning. And we'll have someone checking those, and then we'll call your name or we'll announce the last digits of your phone if you're joining by phone, and you'll be able to ask your question or submit your comment. If for some reason you can't fill out the online form, you can still email us your requests to speak or to ask a question at safer@waterboards.ca.gov. We also encourage you to email us there if you have any technical difficulties at all during the meeting. We have someone actively watching that email for any emails that come through. Before we get started, I just want to say that we have a lot of state water board members that have been working really hard to make sure that these webinars can happen and that we have as few bumps as possible. And I just want to say that we're all here to support this process and to make sure that we can hear from you and have really enriching, meaningful discussions around these topics today. I just want to acknowledge the dedication of our team and thank all of our participants for finding this way to join us today. And now I'd like to introduce you to Kristen, who's going to be your host for this morning's meeting session. Thank you.
Hello, everyone. Thank you so much for joining us today. My name is Kristen Appold, and I'm the Senior Environmental Scientist for the Needs Analysis Unit. And I'm going to be introducing our session this morning, and I really hope that you tune in for the session this afternoon that's hosted by the Division of Water Quality. Before we get started, I just want to launch 2 quick poll questions just to get a sense of our audience. Let me do this real fast. Relaunch it. Okay. I'm going to give you guys a chance to respond. Our first question is, did you participate in or review the April 17th webinar on our risk assessment for public water systems? This webinar today is the second webinar in our series, just trying to see who logged in for our last session. And then our second question is, have you read the draft white paper, Identification of Risk Assessment 2.0 Indicators for Public Water Systems? We shared this with the email for registrants, and we hope that some of you have had an opportunity to browse through it. I'm going to close this in just a few more seconds. Okay. And we'll share the results real fast. It looks like about half of the poll participants were able to either attend or review the webinar from April 17th. And it looks like we've got some mixed responses for folks who've reviewed the white paper. We got a number of folks who have read the whole thing, a few that have skimmed it, a few who have not, but plan to, and then a few who are not intended to read it. So thanks for sharing that. It's really helpful as we dive into our presentation. Bring this back up. Okay. So today I'm going to provide a brief overview of the Division of Drinking Water's Needs Analysis Unit. I'm going to provide again an overview of our needs assessment work. And then we're going to dive into our Risk Assessment 2.0 development, what our process is, and what our timeline looks like. This org chart may be a little difficult for you guys to read, but we provided it in the PDF version of a handout. The Needs Analysis Unit is a brand new unit within the Division of Drinking Water, and we're in a brand new section, the SAFER section, which you can see is managed by Michelle Frederick. We are one unit of three that's under the SAFER section. We work with the Northern Engagement Unit and the Southern Engagement Unit, which are scattered across the state. And we are part of the Resiliency and Data branch, a brand new branch within the Division of Drinking Water. Most of the staff within the Needs Analysis Unit came on board earlier this year. We're almost fully staffed up, but we are here to support the SAFER program. And I just wanted to provide folks a sense of what we're working on since we are a brand new unit. Our unit is responsible for the needs assessment work. We are building out a new database called the SAFER Clearinghouse to help us implement the SAFER program. We've assumed responsibility for capacity development within the Division of Drinking Water. We're working on improving our water system boundaries and collecting new data and hopefully improving data quality, not only within our existing databases, but also with new data collection efforts, especially around those related to state small and domestic well data. I do want to emphasize that our highest priority is the needs assessment, and we're building off the groundwork conducted by our sister agencies in this space, and we're transitioning this work from a series of assessments into an ongoing annual needs assessment. Our goal is to harness the technical knowledge, processes, and stakeholder engagement that has been utilized by these other state efforts as we move forward with this work. There we go. Just to recap the SAFER program and how it all fits together. So most of you know, but just to do this again. So the Senate Bill 200, which passed in 2019, enabled the establishment of the SAFER program, the Safe and Affordable Fund for Equity and Resilience program. And the SAFER program is a set of tools, funding sources, and regulatory authorities that help us support struggling systems so that they can provide sustainable and affordable drinking water. SB 200 created the Safe and Affordable Drinking Water Fund, which enables up to $130 million a year through 2030 to support the SAFER program and its activities. The annual fund expenditure plan, which we just released and finalized, prioritizes projects for funding and documents past and planned expenditures, and is meant to be based off of data and analysis drawn from the drinking water needs assessment. And that's what we're going to talk about today, is the needs assessment. The SAFER program is implemented across the state water board by a number of divisions. It is an agency-wide effort. It's not just within the division in drinking water, and I wanted to highlight a few of the players here. So the Division of Financial Assistance is responsible for the annual fund expenditure plan, and they work together with the external advisory group to inform the development of that plan. And then they're responsible for executing the funding associated with the SAFER program. The Division of Drinking Water is responsible for the needs assessment, data collection, and engagement with systems throughout the state to help connect them to technical assistance and financial assistance. The Division of Water Quality is responsible for identifying at-risk state smalls and domestic wells, and in particular, really diving into source water quality. And then the Office of Public Participation, who are doing a fantastic job moderating this webinar. They help us with public engagement and meeting facilitation, and they work with our engagement units throughout the state to make sure that the public has an opportunity to engage in the work that we're doing within the SAFER program. And I really want to highlight and call out a lot of our collaboration partners. We are working with a lot of groups, both state agencies and nonprofits and academics in implementing the SAFER program. We have a contract with UCLA, and that's who is co-presenting with us today, this morning. But I really want to emphasize and highlight the sister agencies who are doing similar work and that we are striving to collaborate with. OWEHA in particular has conducted an assessment of California water systems, of those that are providing safe, accessible, and affordable drinking water over time. They have a great deal of expertise on the development of indicators, which have been developed over many years, and they have helped lay the foundation for the risk assessment work that we're doing. CPUC is exploring approaches for measuring affordability for utility rates. I really encourage all of you guys to check out their affordability metrics framework. And the Department of Water Resources is supporting integrated regional water management needs assessment work throughout the state. They're implementing SGMA, and they've developed a drought risk assessment tool. We are trying to leverage their work, especially their risk indicators and assessment results, into what we're doing. A tremendous amount of effort went into these tools and approaches, and we are building off of these as we develop our needs assessment methodologies. These efforts embrace a public engagement process, develop their recommendations and methodologies, and we strive to honor that approach as well. So let's talk about the Water Board's needs assessment. Our needs assessment has three core components. The first is an affordability assessment, looking at rates and what customers are paying for their drinking water services. The second component is the risk assessment, which we're going to be discussing today. And then the third component is a cost estimate for interim and long-term solutions. And I'm a visual person, so we have a little bit of an infographic here so folks kind of see how they all fit together. Our affordability assessment uses metrics in order to determine what is affordable. And we used percent MHI for our last fund expenditure plan. And we are currently exploring alternative metrics for measuring affordability beyond percent MHI or in addition to. The metric that we use for affordability is going to be one of many risk indicators that we're looking at for our risk assessment work. So this is that middle icon right there. Our risk assessment is used to help us identify those at-risk systems, those systems that are at risk of failure. Our cost estimate is looking at what it will take for us to help address those at-risk systems and our human right to water systems, those systems that are currently out of compliance. And that dollar amount is to help us plan for the future and how to help implement the SAFER program. Today's webinar, again, we're focused on the development of our risk assessment methodology. The SAFER program uses the results of the risk assessment methodology to help us with the prioritization of where we're going to be focusing our efforts for TA, for on-the-ground help, for financial assistance, et cetera. We use the results of all of our needs assessment work to do this. As a regulatory agency that's focused on human health, the human right to water systems, those systems that are out of compliance, are our top priority. Next is our at-risk systems and domestic wells, potentially at-risk systems and then our not-at-risk systems. But it's to help us focus our limited dollars and our limited time towards those that need our help the most. The risk assessment can really be broken down into 3 core components. The first are risk indicators. So these are metrics, measurable, quantifiable data that we can assess whether or not a system is at risk of becoming non-compliant. We use thresholds for those risk indicators to help us indicate, when is that system becoming more at risk. And then we use weights and scores to help us assign criticality to those different indicators. And we heard from our last webinar that there are some indicators that folks feel like probably outweigh others in terms of their importance in terms of overall risk. Today, we're really focused on the identification of potential risk indicators. We want to make sure that we have the right mix of indicators in our assessment. Future webinars, which are going to be hosted this year, will focus on thresholds and weight and score methodologies. Just a recap from our April 17th webinar, we dove into our risk assessment 1.0 indicators. And I encourage everyone to check out the webinar recording and then our draft white paper that we released, because the appendix really dives into each one of these indicators. We have focused since April 17th on identifying additional indicators that we should be considering for risk assessment 2.0. Again, just to focus on some of the public feedback that we received and that we have been striving to address in our methodology. We heard loud and clear that folks wanted us to make sure that our risk indicators aligned with the human right to water goals. So we have developed definitions and indicator categories for water quality, accessibility, affordability, and technical, managerial, and financial capacity. We also were asked and have spent a significant amount of time exploring indicators that is used by other state efforts. And we wanted to be more transparent in the work that we're doing and publish a white paper prior to our webinar so that folks can really dive into our work and provide more meaningful dialogue and discussion when we host these webinars. So again, really glad to see that a number of you have had the opportunity to review the white paper prior to today's discussion. I really wanted to just highlight that our risk indicators, it's important for us to look at these through a compliance lens. Because of our nature as a regulatory agency, we really need to have that focus on systems that are in compliance with safe drinking water standards. Here is our timeline and our process. So we've broken this up into manageable chunks because we want to make sure that we have opportunities to engage with stakeholders throughout the development of our risk assessment. We are currently at stage 1. We have identified potential risk indicators and we're looking for feedback on what we've developed. We've also developed an evaluation tool so that we can evaluate our risk indicators to help us narrow down our list to something that's more manageable. The next few stages are looking at what are our thresholds, what are our scoring and weighting approaches. We want to make sure that we put a few options out there and get feedback from the public on what we're thinking. And then finally, we're going to be pulling it all together into our final methodology to conduct our final risk assessment for our 2021-22 fund expenditure plan. And our goal is to have this methodology finalized by the end of the year so that there's no gap in progress and that we can have a fund expenditure plan that has a new list of at-risk systems for the next fiscal year. This is our timeline, and you can see we are currently on track. We are hosting right now our last webinar related to the identification of potential risk indicators. Our goal is to host another webinar workshop in September or October, where we discuss the final selection of risk indicators. We are then going to be working on setting thresholds and developing a few options for weighting and scoring. We're going to test those with historical data for water systems, and then share that with the public so you guys can get a sense of what we're working on and provide feedback on some of the assumptions and assumptions that we're making for these different methodologies. And then using public feedback, we're going to finalize our Risk Assessment 2.0 methodology and conduct the risk assessment for the next fund expenditure plan. But that's not where this stops. And I really want to emphasize that what we develop by the end of this year for Risk Assessment 2.0 is not the end point. We definitely plan on improving our risk assessment methodology on an ongoing basis. And what does that mean? That means that we're definitely going to need to refine our data collection and data quality. You'll see later in the presentation, when we evaluate risk indicators, we're probably going to identify a number of really great risk indicators that don't meet the criteria that we've set in order for us to use it in our risk assessment, either because we're not collecting that data or the quantity that we collect doesn't meet our standards or the quality is not great. So we're going to develop long-term strategies within the Water Board to improve our data sets. We're also going to work internally, but also with our external stakeholder partners to conduct studies to support either the indicators that we're using in our risk assessment or our thresholds and help us refine those over time. We're going to do that also by learning from what we're doing in the field with supporting our human right to water systems and our at-risk systems and domestic wells. And we're going to work with our internal and external partners to build off of the work they're doing. We know that our sister agencies are supporting robust risk assessments in other areas like the drought risk assessment. We want to make sure that as they move forward with their work that we incorporate it into what we're doing as well. And we'll continue to iterate as we move forward over time. So this will not be the last. And I'm going to hand the reins over to Greg, who's going to dive into the details. Greg?
Yes, thanks, Kristen. And hello, everyone. My name is Greg Pierce from the Luskin Center for Innovation, Department of Urban Planning, UCLA. I look forward to discussing and engaging with you all on this presentation and these topics today and in the future. So today, my presentation is really going to focus on 3 different topics and really picking up exactly where Kristen left off on first identifying and defining the 4 categories of risk indicators that sort of frame the risk assessment 2.0 process, then diving into the actual indicators across the 4 categories, which we currently have 118 of. And then the last section will be focusing on the evaluation tool, draft evaluation tool that we are proposing to use to evaluate those 118 potentially plus indicators for actual inclusion in the risk assessment 2.0. I will point you to now and throughout the presentation something that I think both Amanda and Kristen mentioned, which is that there are more details than we can present here in the published white paper that was sent out to those who registered for this webinar, as well as on the Water Board's website. And we welcome feedback on everything in the presentation, as well as the white paper, of course, both on the webinar and by emailing safer@waterboards.ca.gov. And we particularly welcome public comment on each of these 3 components. And we are looking for, ideally, the board is looking for public comment by about a month from now, by August 21st, in order to move forward at the pace that Kristen mentioned and come out with a risk assessment 2.0 early next year. My presentation, again, is sort of 3 different topics, and after each one, I will not just present sort of in succession. After each one, there will actually be opportunities for public comment and discussion. So my presentation will not run more than half an hour, and there should be about an hour or more for us to hear from you all and to have discussion on these topics. So just FYI in terms of where we're going. But first, again, we are going to focus on the risk indicator categories, which help define the process for risk assessment 2.0. Again, there are 4 different categories, 3 of which directly reflect the human right to water goals: water quality, accessibility, affordability, as well as a 4th category that sort of relates across the other 3, which is technical, managerial, and financial capacity. I will say up front, in terms of these categories, that we have done our best to place individual risk indicators in one category, and there's none that we have placed in more than one, but we are also, in addition to feedback on the category definitions and the indicators themselves, we welcome your feedback and comments on where individual indicators should be placed, because some could reasonably be placed in across categories. In terms of the definitions that we have worked on for the categories, I should also say that I'm largely going to read them here because they are definitions and a lot of thought was put into how they were worded, but the definitions are in some ways more defining the breadth of the type of indicators in each category. Each indicator does not necessarily touch on all the dimensions or aspects that you see in each category. It's meant to sort of help organize the risk indicators rather than define each one in full. But of course, the first category that we have, since the focus of the risk assessment is on compliance with water quality standards, is water quality, and really defining water quality risk indicators as those that directly correspond to California's safe drinking water quality requirements, or measure current water quality and trends to identify likelihood of future compliance with water quality and treatment technique regulatory requirements, and or measure the frequency and duration of exposure to drinking water contaminants. And a lot of those indicators are coming directly from work that sister agency to the Water Board, OEHA, has developed. Next category is accessibility, which we are in the board are broadly defining risk indicators as those that impact a system's ability to deliver safe, sufficient, continuous drinking water to meet public health needs. But these indicators, again, have some breadth in that they may measure risks impacting a system's quality and quantity of source water, and or they may measure the reliability and volume of its delivery or distribution of water, and or the access of customers to safe drinking water, sort of at the tap point. Next, in terms of, again, the goals of the legislated human right to water, we have affordability. And here we are defining affordability as being defined or bounded as risk indicators that measure the capacity of and burden placed on households and the customer base as a whole to supply the revenue necessary for a system to pay for necessary capital, operations and maintenance, or O&M, expenses to deliver accessible, safe drinking water. And again, in terms of affordability, there will be a parallel affordability assessment that will have quite a bit of overlap with the affordability risk indicator category and use of risk indicators in the risk assessment. But then last but not least, we come to technical, managerial, and financial capacity, commonly known as TMF capacity. This category and the indicators that are collected for it and ultimately used, again, will have quite a bit of overlap with the parallel capacity assessment that the needs analysis unit at the Water Board is undertaking. But here we are defining TMF capacity indicators as those that measure a system's technical, managerial, and financial capacity to plan for, achieve, and maintain long-term compliance with drinking water standards, thereby ensuring quality and adequacy of the water supply. So I know that's those are precise or carefully worded definitions that perhaps if you have not seen the white paper, you have to take some time to mull over. But we do want to ask a direct poll question and then actually turn it over to public discussion and comment about your thoughts. And the poll is now up. And for those of you who are on the phone, the poll question is, do these risk indicator category definitions capture what the State Water Board should be considering for Risk Assessment 2.0, with the options for response being, yes, I like these definitions, maybe I think they need some minor edits, and no, these need to be reworked. So we'll give you about 20 more seconds to vote for those of you who are on the Zoom. All right, I'm going to, polling has been ended, and I think you all can now see the results, but I'll read them out loud for those who are on the phone. Looks like about 56% said that they like these definitions, 41% say maybe I think they need some minor edits, and about 3% think they need to be reworked. So thank you for that. Thank you for sharing your initial thoughts there. Now I will actually turn it over to Amanda to facilitate public comment and discussion, particularly, and we are looking here, again, particularly for comments and discussion on these risk indicator categories. We will have time for comment and discussion on the indicators themselves and the evaluation tool and all the topics later in today's session.
Thank you, Kristen, and thank you, Greg. So now we're getting into our first discussion topic, which is risk indicator categories. We've received quite a few comments through our forms link. If you would like to submit a comment and ask a question, there's the link again. It's the bit.ly@risk2am web address. I do want to say that a lot of the content of our questions so far has been around that how do we comment on this process? How can we get involved? What's the timeline? So I'm going to just open that up to the group to answer how criteria, is there a way for them to do that? And what's the timeline for incorporating the comments? So if we can get an answer on that, and then we'll follow up directly with folks and see if they had anything else to add.
Hi, Amanda, this is Kristen. So we have put out a deadline for written comment to the Water Board for August 21st, I believe. And you can submit those written comments to our safer@waterboards.ca.gov email address. And we have instructions on our one of our last slides on how to do that. And we really encourage folks to reach out and provide as much feedback or comment on our white paper and our approach and what we're presenting in today's discussion. We look forward to your feedback.
Thanks for addressing that, Kristen. I just wanted to follow up with some of the folks that did ask that question specifically. The first person was Jonathan Young, and Jonathan, I just unmuted you. Did you have anything else that you wanted to add or discuss about that question?
No, that was it. Perfect. Thank you very much.
Great. And we're looking for others that also commented, and we'll be unmuting you too. So the next questions that we're getting, and we're going to be unmuting folks, so you can follow up with a discussion. The next question that we have is from Cindy Tuck. And Cindy, I'm going to try to unmute you right now so you can ask your question, but I'm having a hard time finding you on the participation link. So just want to give a heads up to folks who are participating by Zoom. If you can go in and rename yourself to the name that we could easily find if you do want to comment, And when you do provide your form, if you're not joining from the web address and you're joining by phone, please be sure to add your phone number in there so we can find you easily. So give us just a second. We're going to try to get Cindy Tuck on.
Amanda, Cindy indicated that she was going to drop off at 9:30, so we may have missed her.
Oh, she did. Okay. Well, thanks. I'm glad we're communicating that. So I'll go ahead and just read Cindy's comment for her. It was mostly about the comments being accepted, but she just wanted to know also if there was any other access points for public for being a part of the public process, for public to participate in the process.
Thanks, Amanda. We are trying to schedule more of these public webinar workshops as we move forward to give the public an opportunity to engage in every step of our methodology development. And so we encourage folks to participate on those webinar workshops. But we're also happy to schedule calls and individual meetings to discuss recommendations and comments to dig in more detail. And we're definitely open and looking for recommendations on how we can improve our stakeholder engagement process as we move forward with our risk assessment methodology development. So if you have thoughts or ideas, please don't hesitate to, again, email us at safer@waterboards.ca.gov, or you can comment during this webinar if you've got an idea right now.
Thanks, Kristen. And I also want to let folks know that at the end of this webinar, we will be sending out an evaluation link, and that would be a great opportunity for you to evaluate this webinar and also add comments in there for how we could improve our public engagement process. So to wrap up this discussion topic, I just want to let Stacy Taylor know that they are unmuted, and if there's anything else that Stacy would like to add to this or any further questions that you had.
Hi, it's Stacy. Can you hear me okay?
Yes, we can, Stacy.
Oh, great. Thank you. Good morning. Thank you very much for your presentations this morning. Yeah, you actually answered my question about process. It was a similar question that probably Jonathan Young had as well. So thank you for that. I did have another question, though, about resources as far as conducting, the screenings for these systems. At the top of page 11 of the white paper, there's 3 categories: in violation, at risk, and then potentially at risk. And together, those total 83% of the systems. So I was just wondering, is it the intent to screen all of these? And if so, how much is that screening going to cost out of the 34 million or so that has been allocated so far to the at-risk category of the fund expenditure plan? And do we think that's a good use of our resources and funds to do this screening annually? So that was my resources question.
So this is Kristen, and I'm trying to see if we have anyone from DSA on board who may be able to address that. If not, then perhaps Andrew would like to chime in on that question.
Sure. This is Andrew Altavogt from the Division of Drinking Water, and I can try to address that. So in terms of resources in the fund expenditure plan, the money that's listed, or the allocations that are listed for the at-risk and potentially at-risk, I think it was the 34 million that you referred to, is for direct solutions for those systems. So it's actually not for the evaluation itself. So the evaluation and the things that we're talking about today are actually being done with our staff time, and so that's separate from the allocations that are in the fund expenditure plan. So I don't know if that answers your question. But.
Well, could I also add, I think, Stacy, you're referring to the list of at-risk systems labeled as at risk in the risk assessment 1.0 process, which is not the process or list of systems that are being considered or sort of allocated $34 million in the fund expenditure plan. And that is a smaller list of systems, and risk assessment 1.0 is not being used in the expenditure plan, or is not being planned to be used in future expenditure plans because of risk assessment 2.0 is being developed. So I think that may speak to your question as well.
Okay, great. So I'm confusing 1.0 with 2.0 perhaps. But do you have an idea? I think the white paper said there was going to be annual screening. Do you have any idea of, the cost of doing this annually, and what, do we have the resources for that, and where is that staff funding coming from for staff time?
Sure. So this is Andrew Altavogt again. So I mean, in terms of the resources are going to be coming directly from the staff allocation. I think in the fund expenditure plan, it does sort of delineate the overall staff costs for the whole program, of which the needs assessment is one piece of that. I don't know. I couldn't tell you offhand how much the staff costs for just the needs assessment are, but it it is a piece of the program, and that's where the funding is coming from the staff cost allocation, and again those are at least the total staff costs are mentioned in the fund expenditure plan. But there aren't additional contract resources or anything like that at this time.
Okay, great. Thank you, Andrew. I just want to make sure that we're, if we do have limited resources, that we maybe prioritize our focus for the issues and the problems that we know, the known knowns rather than the unknown unknowns, the at risk and further down the line potentially at risk. That would just be my one plug to focus on those already in violation and or at risk. But thank you very much. I appreciate the opportunity to comment.
Thank you, Stacy, and thank you, Andrew and Greg, for your responses there. We're going to wrap up this discussion topic and move on, but before we do, I just want to ask one more time if anyone has anything else to add to the question that do these risk indicator category definitions capture what the State Water Board should be considering for risk assessment 2.0? I'm going to give you an opportunity to raise your hands if you're joining via Zoom, and you can let us know if you would like to add anything or ask another question on this topic. For a second.
I see a hand raised.
A moment
Amanda.
to do that. I think we have Kristen Johnson. So Kristen, I'm going to go ahead and unmute you.
Hi, good morning. Can everyone hear me?
Yes.
Great. Hi, Kristen Johnson, Coachella Valley Water District. Actually, my comment is still back on the process question and how to engage and how to comment on the white paper. And I appreciate everyone saying that email the SAFER email address by August 21st. That's been made very clear. However, I would highly encourage folks to get that information on the actual public notice page of the Water Board website. As of right now, this information seems to be a little bit buried on the SAFER program page, and it is not on the actual public notice page where documents are available for public comment. So I would just encourage people, encourage staff to get that up there, because I think unless you're really closely following the SAFER program and the development of all of these processes and separate elements, it might get lost to some members of the public. Additionally, I just thought I wanted to go back to something that Kristen said when she mentioned the advisory group and that they were responsible for engaging with the Division of Financial Assistance. And again, on this topic of public engagement, you know, CVWD is fortunate enough to be represented on the advisory group with Vice President Costello Estrada, and I think it might catch some of the members of that group off guard to hear that they're, you know, only viewed as engaging with Division of Financial Assistance. I think they probably view their role as a little bit broader and advising on all policies related to the SAFER program as a whole. And so maybe some direct outreach to that group with regard to, you know, 2.0 and these risk factors might also be advisable. So thank you.
Great, thank you, Kristen. Really appreciate that. I don't see anyone else's hand being raised for any further questions. So we're gonna go ahead and move on. So I'll hand it back over to Kristen. Or Greg.
Yeah, thank you, Amanda, and thank you to everyone for your comments and questions. Next, we are going to jump from the risk indicator categories to risk indicators themselves. But first, before we show you some of the risk indicators in the respective categories, I want to talk a little bit about the process of how we got to this point from April. Essentially, we and the board did quite a bit of work researching and consulting with various federal or national, other state and nonprofit organization efforts to collect and analyze risks for drinking water systems or drinking water systems performance more broadly. But in particular, I want to highlight something Kristen has already highlighted, which is a concerted effort to both consult with staff and to thoroughly analyze and to include potential risk indicators from 3 other California state agency efforts around risk or water system performance, particularly, well, first, the Office of Environmental Health Hazard Assessment, or WEHA's Human Right to Water Risk Assessment and Data Tool, from which we have included all 13 indicators, I believe, in the Water Board's potential risk indicator list, as well as secondly, the Department of Water Resources, which has 2 ongoing efforts, or perhaps one is recently completed. First of all, it's integrated regional water management planning efforts, and then secondly, namely in terms of our ability to include indicators directly from their efforts, DWR's drought and water shortage risk scoring tool, from which we have included 29 indicators, all that were possible that assess performance for public water systems, again, in the potential list of indicators in the Water Board's risk assessment. And then last but not least, also have consulted with and included indicators from the California Public Utilities Commission's affordability metrics framework. 3 indicators are currently in that framework, which I believe is a stage of a proposed decision at the CPUC, and has just gone through public comment through its intervener process. But we have included the 3 indicators that are included or proposed in that framework so far. And we will continue, and the board will continue to consult with and draw on these efforts and build on these efforts in coordination as this process moves forward. But before we move on to the indicator list itself, we want to ask you whether well, I'll just read the question for those who are on the phone. This is a poll question, so please respond if you're on Zoom. Are there other state or federal efforts the State Water Board should be considering when developing Risk Assessment 2.0. The options for response being no, you're considering the key efforts, or yes, I will submit a public comment to identify an additional effort. I'll give you 20 more seconds to respond. And looks like I think we can wrap it up here. And it looks like the results from the poll, which those of you on Zoom should be seeing, are that about 70% say that the Water Board's risk assessment is considering the key efforts, whereas 30% say it is not. We ask those of you who say that this effort is not, that you would submit a public comment or of course chime in here on the webinar so that we become aware of the additional efforts. We have, again, I'm not sure. We have made an attempt to include every effort that has risk indicators for drinking water system performance. We welcome hearing more. I'm sure that we can improve and potentially expand the list of indicators based on your knowledge and expertise. With that, though, I do want to move on to the indicators that we have been able to include so far. And here I do, again, want to stress that, well, in terms of presentation, I cannot go through all 118 indicators here. I don't think you probably want me to, but they are fully detailed. There's a definition as well as the source from which we drew the indicators in the white paper. Please look at those and also provide comment. But what I'm going to present here is sort of a landscape view of the type of indicators in each of the 4 categories that are currently included. I want to stress that the indicators that you see on this slide and the next few slides are not the top indicators in each category, or of course the bottom indicators. They're actually trying to show you the breadth of the types of indicators that we have currently in each category. And I'll just highlight a few here, again, starting with water quality category, where we have 25 potential indicators. They range from indicators such as the frequency of bacteriological violations, total chloroform, which reflect current compliance, to the frequency of water quality trends toward a maximum contaminant level violation or toward going out of compliance, as well as factors such as whether a public water system source is close by or proximate to a septic system, which might be causing contamination to the source water of the water system. Next, we come to accessibility, which I believe is the winner for the most potential indicators, and really, again, reflects on several different dimensions of accessibility. First being source and storage capacity. So we have the number of water sources the system relies on, as well as whether the system has adequate water storage capacity, as well as indicators that reflect the performance of the distribution system and sort of the reliability of the distribution system, including the frequency of water outages, as well as the pressure in the distribution system. And then we have other indicators that try to combine or sort of reflect both source water as well as delivered water and the difference between them, such as water loss or non-revenue water. Then next, in terms of affordability, again, we have 22 potential indicators. You can see the full details of these indicators in the white paper, table 5, page 23 in this case. But for affordability, again, we have a breadth of indicators, including those that reflect sort of existing economic conditions within the community, such as the poverty prevalence indicator that measures the percent of the customer base that's below 200% of the federal poverty level, as well as indicators that measure sort of the amount of labor or income one would need to pay for a water bill, such as the hours one would need to work at minimum wage in the local area to pay for 600 cubic feet of drinking water service from their local system, as well as indicators looking at the amount of affordability assistance that are available to customers, including sort of the number of customers receiving water bill payment or low income rate assistance currently. Then last but not least, come to technical, managerial, and financial capacity, where again, we have 35 potential indicators. And here, of course, with technical, managerial, and financial capacity, it's really, in some ways, 3 categories in one. But first, in terms of financial capacity, we have quite a few different indicators. I'll just highlight the indicator days cash on hand, which is sort of a measure of liquidity and reserves that water systems rely on in times of revenue shortfalls, which is something that I know a lot of folks are concerned, particularly at this time, as well as we have strove to collect other technical and managerial capacity indicators, such as the number of staff per water system connection, as well as the presence of a full-time operator of the water system and the certification of the operator, and then other sort of broader measures of TMF capacity, such as the size of the system, the number of service connections, as well as sort of the presence of and the recency of updates to the water system's rate structure. But again, that is just some, I don't even want to call them highlights, but a landscape view of the type of indicators in each category. There are 118. We know that if you haven't looked at the white paper yet, it's going to be difficult to give a firm opinion on this poll question, but we are still looking to get your response and see whether you, for those of you who have looked at it, sort of whether the potential risk indicators identified in the white paper align with your expectations, with the options being yes, maybe, maybe, or no. Now we'll give about 20 more seconds. All right, I think we're gonna close the poll here, and it looks like the results are fairly mixed, with about 25% of folks saying the risk indicator list currently proposed as potential does align the indicators they had in mind, about 40% saying maybe they haven't had a chance to review all of them yet, and then another 35% saying maybe there's some that need to be added or removed from the list, with apparently no one yet responding no. Thank you for your feedback, and we will now, I will now turn it over to Chris, or to Amanda, to directly solicit public comment and discussion on this topic, as well as, again, we really welcome your detailed feedback through public comment and other discussions over the next few months.
Great, thank you, Greg. And we didn't have any new form entries come through our question and answer submission site. So we are going to go ahead and ask folks to raise their hand. We have a queue I'm going to follow up with Stacy first to see if she had anything, because I know this was one of her questions. So just briefly, if there was anything else here that you wanted to add. And then we have Jonathan Young. So I'm going to list the order so you can be prepared to go. So we're going to start with Stacy first, and then Jonathan Young, and then we have Jesse Deliwal. Sorry. And then we have Ryan Jensen and Cindy Tuck. So in that order, we're going to go. Stacy, I'm going to unmute you. Hopefully I'm going to unmute you if you're still on. If there's anything you want to add to follow up.
Sure. Thank you so much. Stacy Taylor again, Water Policy Manager, Mesa Water District. Thank you also. I just want to thank your public participation folks for the polling. I think it's a really nice feature. And so good job on that. My questions or comments on this section actually pertain to pages 23 through 25 of the white paper on potential affordability risk indicators. Specifically, the several indicators in this section that look at 6 units times the water rate. I know I've commented on this before, so bear with me for saying so again. But if we're just looking at the water rate times the number of units, we are not capturing an accurate picture of the full true cost of water that is borne by residents. Again, that cost is made up of several components, which is the rate plus the meter charge, which is known as the fixed charge or connection fee, plus any taxes and special assessments that do go straight to the water system from property owners, including residents in the area that receive the water service. So, you know, as a policy, we really need to get away from just looking at the per unit water rate. That will have rippling effects with water systems potentially changing how they do their rates. You know, water systems, we're all nonprofits, and so everything is fungible. And so, you know, if a water system wants to look really affordable, if we're just looking at the rate, it's very easy for water systems to reduce their per unit rate and put everything on the fixed charge, or reduce the water bill and putting everything into special assessments and taxes. So just want to be really careful about what we're considering here in terms of policy. The other comment I wanted to make is on the percent shutoffs as an indicator and duration of shutoffs. Those are at the top of page 25. And really, those are irrelevant now because no water systems are shutting off their water due to the Senate Bill 998 by Senator Dodd that passed, as well as during COVID, the governor's orders. And so I don't know if those are going to be relevant any longer. And then finally, extreme water bill, also at the top of page 25, again, looks at the units times the rate. And I already stated why that's problematic. But then it's divided by the average state water rate. And again, this is relevant because water systems are nonprofits and we can only charge for the actual cost, not a penny more, not a penny less of water service for the customers. And so the cost is the cost. In some affluent areas, it may be a higher cost. In some areas that are less affluent, may be a lower cost. So I'm not sure if the average state water rate gives meaningful information as a metric. And I'll stop there and leave time for others. So thank you again.
Thank you, Stacy.
Yeah.
I want to wait. I'd like to pause there. I'm so sorry. I'd like to pause there before and let folks know if you're on the phone and you would like to raise your hand, you can press *9 on your phone and it'll raise your hand and we can know that you want to talk. So thank you for that interruption.
So this is Greg from UCLA. I will briefly respond and then Kristen, please feel free, or others feel free to weigh in. And you mentioned a number, thank you for your comment, and you mentioned a number of topics. So I will try to address the main 3 I heard. The first is I just want to note that the 6 CCF measure does include both the fixed charge and variable rates, so it doesn't just include variable rates. The second sort of part, I think your main comment around how rates don't reflect the true cost of water is something that the board is trying to work on to get better data on. And I think Kristen can weigh in on the potential availability of that data. But for now, we are largely limited to rate data. The water board is in terms of its collection and sort of the validity of that data, although that will be something that will be explored and sort of written out over the next few months as the evaluation tool is applied to these various indicators. But then I also did want to, on the shutoffs component, the governor's order, yes, does currently ban shutoffs, and it's still under effect. I couldn't comment as to how long it'll be under effect, but SB 998 does not, and there were certainly systems that were shutting off service before the governor's order. So it really depends sort of what is done with the governor's order in the future as to whether shutoffs are a pertinent metric. And then the last point on the extreme water bill, which is something that is really drawn from the board's AB 401 report process. I just want to note that it's not simply looking, and maybe the white paper doesn't fully spell it out. It's not simply looking at deviations off the state average of 6 CCF bill. It's looking only identifying systems that would be above 150% or 200% of the state average. So it's a fairly conservative measure. Yes, I think the board certainly hears the point that water rates are going to vary for common consumption level, perhaps vary quite substantially. And your comments again about the rate or the water bill as being insufficient to fully measure water cost. But I just wanted to note that, and I think I'll let Kristen respond if she'd like.
Yeah, thank you, Greg, and thank you so much for your questions. Yeah, the water board, we are working right now to try to develop some additional electronic annual report questions that could help us get more at the full cost of water for customers that encapsulates some of the points that you brought up. Because right now we are not collecting that data, and it's something that we can highlight and emphasize in the thorough evaluation of these risk indicators using the evaluation tool, and discuss that during our next webinar. So definitely a good point, and one we are striving to address, but that data just isn't available at this moment in time and would not be available for the next iteration of the fund expenditure plan, but something that we're striving to work towards for future iterations of our risk assessment and obviously for the fund expenditure plan.
Great, thank you. Jonathan Young, I believe you are unmuted if you'd like to go ahead and talk.
Great. Thank you so much. And Greg, I do know that Aqua and CMUA and a lot of our water members, respective members, have submitted comments to OWIA and DWR about some of the risk indicators, their weighting, their scoring, what should be considered and what should not be considered. Have you or the board staff taken those comments into account, or are those something, or are those comments something we should reiterate when we're submitting comments about everything else?
Good question. I think the answer is yes, those have been taken into account, but really it's the next stage of the risk assessment that those comments would be most useful. So reiterating them is certainly always helpful, but I think we can note or flag to look at those so that look at those proactively. But the current stage of the risk assessment is sort of fully inclusive of all potential risk indicators. There's 118, there may be more based on public comments here. So we haven't yet proceeded to the stage, but the next stage, starting maybe later today, is to begin to evaluate those indicators. And I think that's where your and colleagues' comments would come in most. At that time. Does that answer your question?
Yeah, I was just to maybe phrase it a little bit better than what I did. For example, when you're talking about water quality indicators, when we were commenting to the Office of Environmental Health Hazard Assessment, we thought violations that occurred 5 years ago, a one-time violation 5 years ago, should be weighted differently than, say, a violation that happened in the last 12 months. So that's something we've commented on previously to AWEA, and just we're curious if it would be a valued comment in this process.
Well, yes, absolutely. And again, we will go back and make sure to look at the comments that were submitted on, DWR and CPUC efforts. But if you can flag them again, those are also welcome, just to make sure we're comprehensive.
Great, thank you so much.
Thank you, Jonathan. Now we're going to go to Jesse Deliwal, and please let me know if I mispronounced your name. So Jesse, you should be unmuted now. Okay, maybe while we're waiting for Jesse to find out how to unmute themselves, we're going to go on to Ryan Jensen from Community Water Center.
I think I'm unmuted now. Can you hear me?
Oh, you got it, Jesse. Okay, thanks. Sorry, we were going to come back to you. Great, we can hear you. Go for it.
Yeah, so I'm Jesse Dhaliwal with the DDW. So I had a few comments. First of all, on the accessibility portion of the risk factors, I was going to mention that there was distribution pressure, but there's also distribution system condition itself, where we have systems that have old pipes or undersized pipes or leaking pipes. And so the system is in poor condition itself. That could also lead to risk factors in terms of disruption of water service when those lines break, when there are leaks, like that. So that's one situation. So maybe that's something we could capture somewhere. How is the distribution system condition, and the pipes we have, how old they are and what size they are. And in terms of the first section about water quality monitoring, there's a section about monitoring violation, about having MCL violation, but maybe also look at history of the monitoring violations. How many monitoring violations have they had? Are there occasions where they don't take water samples that are required by regulations? And somewhere capture their history of monitoring violations, where they got enforcement for not taking samples or not following up on positive samples. So those would be my comments. Thank you.
Yeah, so Greg again here. First of all, the monitoring and reporting. Yes, thank you, Jesse. Monitoring and reporting violations are currently listed in the category of TMF, not water quality. So those are being accounted for, but you may have a further comment, and people may have opinions about whether placing them in TMF versus water quality is most appropriate, and we welcome those. Regarding your comment on distribution system performance, I think we welcome further indicators there, and discussion around your particular concern that's being captured in the indicators. I would stress in sort of the next portion of my presentation, will stress that we do, in the next stages, we will be focusing on phenomena or risk factors that can be measured across systems. So whether there's an indicator that fits the topic you're focusing on is really the key question, I think, moving forward. But we welcome that discussion, on the topic you mentioned, as well as all others.
Great, thank you. Next up, we have Ryan Jensen.
Hi, thank you. Ryan Jensen. I'm our Senior Community Solutions Manager with Community Water Center in Visalia. And the comment I wanted to make is around, I know there's a big part of the evaluation of these potential risk indicators right now is whether there's sufficient data available. And I just wanted to express a word of caution about discounting some of the potential indicators due to lack of data. This is particularly true with the TMF indicators. A lot of those are going to require, or collecting that information is going to depend a lot on the internal records that water systems themselves are keeping. And I think in many cases, the lack of that available data may actually be in and of itself a pretty powerful indicator of a system's potential vulnerability or risk. So I was, one of kind of my comments or suggestions would be for some of these indicators, especially the TMF ones, but not exclusively so, things like maintaining a full board, operator training, employee turnover, a lot of this information possibly should be looked at as an opportunity for the State Water Board to be considering whether some of this information should be required for water systems to be reporting to the state in future years. And in the meantime, they'll potentially considering keeping these indicators in the risk assessment, but considering even maybe one additional indicator for each of the categories where you're kind of capturing, like if that information is not available for a water system, but for other water systems it is, really kind of what that is saying is that the water systems that are not going to be keeping good records of their finances, board turnover, staff turnover, these kinds of things are in and of themselves the systems that are most vulnerable on their TMF fronts. And I would invite the State Water Board to think really creatively about how they're considering those, and possibly including an indicator about the lack of available data for some water systems.
Thank you,
Hey,
Ryan.
Ryan, this is Kristen. I just wanted to jump in. Yeah, thank you so much for your comment. Really, really appreciate it. And I wanted to stress something, I briefly mentioned it in my presentation, but I think it's worth calling out here. We recognize, and you can even see it in our tables in the white paper, that there are a number of indicators that have been highlighted, brought to our attention, ones that we've identified ourselves that we just know we don't have the data right now. It's not being collected by the water board. That doesn't mean we're not going to include them in our evaluation, because we think it's important to highlight data, metrics, indicators that we think are important moving forward so that we can develop those data collection strategies over the next few years. And so if you have a suggestion for especially a TMF, an affordability and accessibility or water quality indicator that you probably know we aren't collecting that data right now, that's okay. Still submit that as a recommendation. Our evaluation will show that we don't have that data, but it does help us create really a list of future data that we'd like to be collecting. And we know that it was recommended by you guys, by the state, by stakeholders and the public. So it's a bit of a gap analysis as well. So we really encourage you guys to provide as much public feedback comment on this list, even if you know that we don't have that data. Greg, I'm not sure if you wanted to add anything to that.
Yeah, I would also just add it's sort of a note later in the final portion of this presentation, but I think you're speaking to the issue of what to do with missing data as well, or missing reporting from a subset of systems on an indicator everyone agrees is important. And so there are different strategies for accounting for missing data, not just leaving that indicator out if there's missing data, that we are planning to fully evaluate. I know that the WEHA and DWR efforts have already done an evaluation. We will draw or have accounted for and directly addressed how they handled missing data. So we will be building on those as well as exploring other options. But yeah, again, your point I think is really well taken, and just that's my comment for now. The issue of addressing missing data does get fairly technical, so I think we will be laying out all the options in a future white paper and so directly soliciting everyone's feedback on how they think that issue should be addressed, in addition to the collection of sort of better or higher quantity data, which Kristen touched on.
Great, thank you both. So just to let you know next steps, we're going to take comments or questions from Cindy and Dawn, and I have one comment to read, and then we're going to wrap up and move on to the rest of the presentation. So Cindy, you should be able to unmute.
Hi, can you hear me okay?
Yep, we sure can.
Great. Thank you very much, Cindy Tech. I'm with the Association of California Water Agencies. We really appreciate the State Board staff holding the webinars and appreciate the presentations this morning, which were excellent from Kristen and Greg. Our main comment that we wanted to make today was about public process, because we needed more time to review the white paper, for example, on public water systems. So we appreciate that you've provided a good amount of time for written comments to come in, and we will provide comments. A couple other notes. When we saw that the number of indicators that are being looked at, went up to 118, that's a pretty big number. So I would just, I think you're on this track. You're now kind of in a process to evaluate those and figure out which ones are the ones you want to go with. But I think it's an exercise of figuring out which ones are meaningful and really helpful in this process, and not making it overly complicated. Because if it's overly complicated, that drives higher costs for administration, and it's obviously we want the funding to the extent possible going out for the solutions, but you do need to have good indicators. So we really appreciate that you're working on this process. The final point, I just want to echo what Jonathan Young from CMUA said, because we have been in dialogue with OEHA regarding their proposal, had submitted comments, for example, and I think we can highlight some of those points in our written comments. But as Greg said, you could go back and look at those. I think that would be helpful. So those are my comments, and I appreciate the time this morning.
Thank you, Cindy. Would Kristen or Greg like to respond?
I think thank you, Cindy. And the next part of the presentation will, I hope, give a sense of exactly how the list of 118 will be narrowed down in the future in a transparent and rigorous, but also hopefully not too complicated way. So, but we again welcome your comments on that, that process itself. And I would also just note that please do let us know. We will look at the previous comments made on OEHA and DWR efforts, but if anything, we particularly need to know if your comments or views have changed. We don't want to assume that they necessarily are static over time.
Thank you. Oh, thank you. Thank you, Cindy, for your comments and questions. We're going to go on to Dawn White, who I also want to acknowledge is one of our SAFER Advisory Group members. So thank you, Dawn, for participating and for your comments. And we really always encourage advisory group members to provide feedback on this process. So thanks, Dawn. You should be able to speak now.
Yes, thank you. I've unmuted myself. So I'm Dawn White. I'm with Golden State Water Company. And yes, I am on the advisory group and following this closely. And I'm going to be providing more detailed written comments, but I wanted to just build a little bit on what Mr. Dhaliwal was his comments, because I think they're really important. And with respect to the water quality indicators, I know that looking at compliance related measurements might be easier from a data tracking standpoint, but I think there are ways to look at or assess sort of physical risks to the water systems, and some things that might consider are like uncorrected sanitary defects as identified in system inspections. So I think there is a way to track those. Frequent loss of pressure is reported. And even maybe something along the lines of, unchlorinated water systems or systems that have difficulty maintaining a residual can indicate a water quality risk. So I'll outline those in writing, but I do think there is data available for those based on, sanitary surveys and DDW inspections. So anyway, that's it for right now.
Thank you, Dawn. Really appreciate that. Yeah, we look forward to your written comments as well. Again, any additional suggestions for any of our categories are welcome. So thank you. I don't know, Greg, if you wanted to comment on any of those suggestions.
No, thank you. And please do let us know. The more specific you can be, the better, but we will work with whatever can be provided and try to identify a potential risk indicator.
Yeah. And I do want to emphasize too that all of the recommendations that come in, both through this webinar, but also in written format over the next few weeks, we will be including a full list of added or new potential risk indicators in our next white paper so that everyone can clearly see the full list that we evaluate using the potential methodology we're going to propose during the next phase of this webinar. But we do have one last comment. It was submitted through forms, and the submitter is asking that we read it out loud for them. This is coming from Danielle Coates from the Eastern Municipal Water District. It is EMWD would like to thank the State Water Board, Dr. Pierce, and all of those that contributed to the white paper and the webinar today. And we appreciate the opportunity to discuss and learn more about the white paper and the risk indicators. In reviewing the white paper, we very much appreciate the discussion on this effort being a stakeholder-driven process where the method and supporting data will be transparent and accessible to the public. The white paper outlines a comprehensive list of potential indicators, many of which we are familiar with and others less so. As we continue to internally digest this extensive list, is there an opportunity to provide written comments on the indicators? The results of 1.0 identifies 2,365 systems, or 83% of the systems screened as in violation, at risk, or potentially at risk. When you conduct this assessment, were there clear breaking points between the systems in each of these designations? And based off the indicators in version 1.0 and potential indicators in 2.0, do you anticipate the systems toggling between violation, at risk, and potentially at risk? So thank you so much, Danielle, for your questions. I think there's a few in there. And I do want to reiterate your first question that was around, is there an opportunity to provide written comment on indicators? Absolutely. Please make sure that you email us your comments at safer@waterboards.ca.gov. We'll provide more instructions at the end of this webinar. Greg, the second question in here around the 1.0 systems, asking if there was a clear breaking point between the in violation, at risk, and potentially at risk. Did you want to speak to that?
Sure. And I guess I will try to. I'm not quite sure if I understand the intent of the question, but there are certain standards or thresholds defined for each of those categories, sort of labels, in violation, at risk, or potentially at risk. So those are detailed in the white paper. And in terms of breaking points, though, I don't know if you mean something else. But those are defined in the white paper in full, although those are not necessarily or likely to be what is included in risk assessment 2.0. And again, risk assessment 1.0 is not at this time being used to inform policy or expenditure decisions at the board level. So it is more of a starting or jumping off point than something that is determinative. But I'm not sure, Kristen, if you have anything to add there, or if there's a follow-up question.
Not to that. And I think the last question that's in here around, do we anticipate systems toggling between violation, at risk, and potentially at risk? And I think the answer to that is yes. We probably will see systems that are oscillating between those different categories, but at this point, it's difficult to tell, the percentage or what that looks like over time. I do see actually, Danielle, that you're on the Zoom and your hand is raised. I can unmute you if you wanted to add any additional comment.
Yes, please.
Go ahead.
Can you hear me?
Yes.
I just wanted, I did submit that question this morning before the presentation, so I do appreciate you guys taking a stab at trying to answer it, but your presentation did shed a lot of light on how version 1 and version 2 work together or don't. So I again appreciate the attempted answer, even though because it wasn't clear to me reading the white paper how they related and how they didn't. So I appreciate that the responses regardless.
Great. Well, thank you all for a great discussion. For topic number 2, we're going to go ahead and move on because we have about a little under 30 minutes left, and we still have some more of the content to get through and at least one more discussion round. So we're going to go ahead and Greg, you can take it back.
Great. Thanks, Amanda, and thanks again to everyone for your questions. I am going to go through this final section a little bit briskly because I think we do have a hard stop at 11. We want to allow plenty of time for discussion and comment on this section as well as the entire process and webinar. But the final section of my presentation is really focused on how to take the 118, there may be more, pending your comment, potential risk indicators, how to evaluate them for inclusion in risk assessment 2.0 using a draft evaluation tool that has several steps and sub-steps, and it is intended to be a transparent, again, rigorous, but also comprehensible way to evaluate risk indicators for inclusion in risk 2.0 and beyond. And the next white paper, as Christian mentioned, that will be released, will essentially take the 118, again, perhaps plus indicators, run them through the draft evaluation tool, and then your comments on the tool, and give recommendations for inclusion in 2.0, and then again, solicit your feedback on a recommended list of indicators. So with that, the next, and we will be focusing here really on what the draft risk indicator evaluation tool looks like. Again, essentially it has 3 steps, but step 2 has 3 sub-steps. So we are really focusing here on risk indicator applicability, and then broadly the data fitness to meet or operationalize a risk indicator, which in turn involves looking at data coverage for the indicator, data availability, accuracy and quality, and then all those come together for a combined evaluation of the ability and usefulness of including an indicator in the risk assessment. So first, we really focus, and I think it's natural to focus on the applicability of risk indicators. And this step really, as the slide says, evaluates whether a relatively strong relationship exists between a potential risk indicator and a water system's ability to provide adequate and safe drinking water, with 4 different potential scores given to each risk indicator, or they will be given to each risk indicator. And again, this is in draft form. We welcome your comments on the scores, but those scores currently range between excellent, if there's really strong evidence for the inclusion of a risk indicator mattering for a system's ability to provide adequate and safe drinking water, to ranging from excellent to poor, where there's neither evidence base or sort of recognition among stakeholders in the water sector for that risk indicator. We recognize with applicability that there is some subjectivity or discretion involved in assigning these scores, so we will be providing not just a score, but more detailed rationale for score. And then again, those will come back to the public and stakeholders for assessment and feedback. They will not be determinative at the next stage. But risk indicator applicability is just one part of the evaluation. And once we move beyond that, we are really looking at the ability of data to help us measure a risk indicator. And that we are calling that sort of part of the evaluation broadly data fitness, but in turn comprises three components. The first of which is data coverage, which simply evaluates whether data is available for a sufficient number of California public water systems to be actually included in the tool. With currently our scores or assessments for data coverage being that a indicator would get a score of good if it has coverage for 90% or more of systems, a score of fair if it has coverage for between 65% and 90%, and a score of poor if it has coverage for below 65% of systems. Next, we come in terms of data fitness, we come to the step of data availability, which is really getting at the frequency at which data is updated and available on a recurring basis, with a score of good potentially being assigned if the data is updated annually or more frequently, a score of fair if data is updated less than annually, but at least every 3 years, and a score of poor if it's updated less than every 3 years. Of course, this sort of data fitness and data coverage also will reflect the necessity of data being updated, the frequency of it being updated. We recognize that some indicators will need to be updated very frequently to sort of be valid and evaluate systems fairly, whereas others are more static or change slowly over time. So perhaps they don't need to be updated as frequently, and that will be reflected in the evaluation in the next white paper as well. And then last but not least, in terms of data fitness, we will be assessing the accuracy and the quality of the data provided for each indicator or available for each indicator. And data accuracy and quality really will be an evaluation of whether the data for the indicator reasonably or accurately reflects what it is meant to measure and illustrate. Again, as with data applicability, we recognize that there is some discretion here, and we will be as transparent, what will be as transparent as possible about how it makes this part of the evaluation. But currently, the scoring is proposed as a indicator would get a good score for accuracy and quality if it's coming from a credible source and is correctly reported, a fair score if it's coming from a credible source, fairly or moderately correctly reported, and a poor score if it's coming from a dubious source and or appears to have extensive incorrect reporting. And again, we welcome your comments on the type of sources and the validity of those sources as we go. But step one and step two really lead us to the final step, which is a combined evaluation of a risk indicator for inclusion in risk assessment 2.0. And again, we want to note that we are not simply, or the board is not simply going to give this a one-time score or assessment of yes, the indicator should be included, maybe or no. There is also potential, and there will certainly be a need for refinement or rescoring or evaluating certain indicators, particularly those that folks agree are have a score highly on the metric of applicability, being excellent or good, but where step two results around data fitness or fair or poor, particularly where data are just simply not available for an indicator, these will be retained for consideration for future versions of the risk assessment, and an attempt will be made to improve the data fitness so that those can be included, as well as other indicators potentially where data or availability are good now but may diminish in the future. We know, however, that talking about these steps in the abstract is difficult to process, especially at first. Again, we welcome your comments on each step here, how it's defined, how it's operationalized. But we also want to give you an example before we open things back up for public comment about what this looks like. And what we've done is to use the 14 indicators from version 1.0 of the risk assessment and run them through the draft evaluation tool to show you what the results could look like for all 118 plus indicators in the next draft white paper, or how the scoring would be essentially summarized. And here we are not showing you all 14, but all 14 are included in the white paper. If you want to take a look, we are including 6 just to fit on the screen, and showing you that risk assessment 1.0 indicators themselves would get different scores in terms of potential inclusion in version 2.0, with here on the screen 3 of the 6 being judged as good candidates for potential inclusion in version 2.0, whereas others are fit in the maybe category, particularly due to data fitness concerns, and I believe 1 or 2 indicators, particularly shown here, active standing with California Secretary of State, are currently judged as not a good fit for version 2.0 due to data accuracy and quality concerns, as well as, I believe, 2 to 3 with waterborne illness being shown here as good candidates for the future beyond risk assessment 2.0, again, due to data concerns, but recognizing that the applicability of these factors is good or excellent. Again, we know that that is a lot of information to digest, but we want to ask you directly, based on your impression so far, do you think the steps and criteria in the draft evaluation tool are clear? And we have a poll question up for those of you on Zoom to directly weigh in. And I'll give you 30 to 40 seconds to respond. All right, it looks like we got all the responses we want to get. And it looks like, again, some variation in answers. About 58% of folks say the draft evaluation tool looks great. 38% say maybe it needs some minor changes, and 4% say no, this needs a redesign. So again, thank you for sharing your thoughts there, and we welcome all comments and improvements to the draft evaluation tool as we move forward. But with that, I will turn it back over to Amanda to particularly solicit comments on this portion, and hear from you.
Thanks, Greg. So this is, we've got about 15 minutes left of this meeting. We do have a couple more topics to get through, but we wanted to offer this space here just to see if there's any additional criteria that should be considered for the evaluation of potential risk indicators. And does anyone have any suggested changes to the criteria that is currently included? If you would like to comment on this, we don't have anything coming in from our back-end forms. So if you want to comment or ask a question, go ahead and raise your hand in the Zoom, or raise your hand by phone by pressing *9, and we will unmute you. I'll give a couple seconds here for folks to get their thoughts together. All right. I'll just wrap up the session. So if folks do decide that they would like to comment on any of the criteria or changes should be made, we can do that in just a few minutes when we move on to the next topic. So with that said, I'm going to give it back to Greg and we're going to move on.
Thanks, Amanda. And I do just have a few final slides, and then we welcome comments and questions for the remaining minutes we have. But just want to note, as I'm sure many of you have already noted, a little bit about what we anticipate with the results of using our draft evaluation tool, applying it to the indicators we have so far over the next few months. First is that there may be, or there are likely to be, quite a few indicators that score well in terms of applicability and data fitness, but measure the same or similar phenomena. Part of the exercise of narrowing down the list will be to not include duplicate or highly overlapping factors where it's not merited. Again, largely for, I won't say simplicity's sake, but for the comprehensibility of the framework, as well as from a sort of statistical or analytical perspective. But we will be noting, in addition to what has been articulated in the draft evaluation tool, a thorough analysis of options where there are sort of duplicate or overlapping indicators that do score well, and presented the results to the public for direct feedback on which are most applicable to include in risk assessment 2.0 going forward. And then additionally, something that's been noted multiple times, but say it one more time here, is that we know that there will be quite a few risk indicators that score highly on applicability, but poorly on data fitness, and the Water Board will be developing short-term and long-term strategies to improve, extend its data collection, improve the quality or sort of comprehensibility of the data it has on hand or access to incorporate more of these highly applicable indicators into future versions of the risk assessment. We of course welcome your opinions on which of those are a priority from your perspective and experience, as well as sources to improve data quality and quantity that we may not be aware of. And then last, again, we've talked about these points, but I know it can never be talked about enough. Immediate next steps, especially for you all to be a part of and help shape the risk assessment. We will be incorporating the public feedback we received, what we've already received, to refine both the categories of potential risk indicators to list and the evaluation tool. All the details for that are in the white paper, and you have the opportunity to continue to submit public comment at safer@waterboards.ca.gov with a deadline of August 21st, as well as to engage in additional conversations and discussion with us on a more individualized basis. We will be proceeding, pending further comments on the tool and the risk indicators as soon as possible to begin evaluating those risk indicators that we have, and sharing the results. The board will be sharing the results of that process with the public through a white paper and then webinar targeting the September-October range. I don't believe there's a date set yet, but we will be informing everyone when there is. And then after that, to give a little bit of a preview, the next step following, as Kristen mentioned, will be using results of the evaluation tool to determine a final list of indicators, and then exploring and proposing thresholds for the individual indicators, weighting between indicators and categories, and scoring. Again, all of that will go to the public and stakeholders for feedback and dialogue, but we also welcome your comments on that now as we begin thinking forward on those topics. But I think, yeah, that is the end of my slides, and I'll turn it back to Amanda to facilitate discussion.
So for the sake of time here, we're going to combine the next two questions. So we're going to have open discussion for anything that was missed. And then we also want to ask a final question here is how can we improve public engagement for this process? So there's a couple of ways we could do that. I see some hands are going up, so we can have open discussion on anything we didn't cover in this next 8 minutes. And then also any suggestions that you have for improving public engagement, you can also fill out this evaluation form link that's there or email us at the Safer Water Board's email. So the first person to raise their hand was Jonathan Young. So Jonathan, you should be able to unmute yourself now and give anything you'd like to add.
Great, thank you so much. And I think this question is more for water board staff. For systems that are on this at-risk list, will they be contacted to be made aware of these efforts? And then will there also be an opportunity for them to possibly fill in the blanks in terms of some of the information? I know a lot of this data is coming from the EAR and CIDWIS and the other sources cited, but I'm just curious if there'll be an opportunity for them to also submit additional data as needed. That's it.
Thank you.
Hi, Jonathan, this is Kristen. Yes, I mean, our goal is to make sure that our list is publicly available, and it will be included in the next iteration of the fund expenditure plan. I think we will make every effort to make sure that systems are notified. In terms of missing data, we are in the process, my unit is in the process of working within the DDW Safer program and with with DIT to develop a new database, a new web platform with portals, so that in the future systems will be able to log in and see where we may be missing data from them, how they're scoring with the risk assessment. But yeah, we are exploring those opportunities. I think it may be difficult to put that in a white paper, but we are moving down that path, and hopefully we'll get there as soon as possible. But it's a good point, and it's something that we're definitely striving for. I'm not sure if Michelle and Andrew wanted to add anything to that.
Yeah, this is Andrew Altevogt with DDW. I mean, the one thing I would add is certainly before any of the data is used for, regulatory or funding efforts, we would be doing a lot of on the ground work with any individual systems to, to figure out, and true up anything that needed to be, as well as if there are, through the public process, if there are things that we have missed, we certainly want to make sure that we know about that.
Great, thank you, Andrew, for that follow-up. Next, we're going to bring Jesse back on. Jesse, you should be able to unmute yourself now and follow up with whatever you'd like to share.
Yes, hi. Thank you for the opportunity again to speak. But I wanted to say, maybe this is coming next when those factors are evaluated. But at some stage, I suppose all those good, fair, and poor, those evaluations will be given a score, so that from my perspective, if you look at the numbers, that's probably better way of looking at numbers, so you can evaluate them easily as compared to good. So sometimes there are several factors when you're combining them together. So if there's a numbering system, you assign a number to each and then combine them and then give them a score. Is that what the plan is?
Yeah, thank you, Jesse. That's a good question. I think Kristen can weigh in as well, but I think the proposal is to use the good, fair, poor as opposed to a sort of numerical approach, but that it's inherent trade-off between those two approaches, and I think we're certainly open to comment and stakeholder weighing in that the numerical approach would be preferred or is necessary. So we did look at that, but for now the proposal or the draft is what you see in terms of the sort of those categories.
Thank you.
Yeah, and the only thing I would add, Amanda, just the only thing I would add to that is, you know, our combined assessment tries to be transparent in terms of how we look at the results of step 1 and 2. There was a lot of internal discussion around using a number scoring system, but the reason we went with the recommendation that we've just presented on was more to help this process be a little bit simpler for folks to understand too, because when you start adding the numbers, it can make it a little bit more complicated, especially for those steps where we have quantitative criteria. So again, very much open to suggestions, and would encourage you all to submit comments or even chime in now. I know we're actually, no, submit your comments, we're at time. We'd love to hear from you guys. Go ahead, Amanda.
Yeah, so thanks for that. We just have one last person to share, and that's Kristen Johnson. I'm going to go ahead and ask you to unmute yourself. So Kristen, you can wrap us up with our comments.
Hi, yeah, thanks again, Kristen Johnson, Coachella Valley Water District. So 2 very quick things. I know we're up against the time limit here. First of all, I want to thank Kristen and her comment that she's a visual person. So I do like some of the infographics that are throughout the white paper. I found those extremely helpful to the extent that, you know, the authors can be cognizant of, you know, additional graphics and not just words. I think that's great. I really appreciate the call out box on page 4, noting that the FY 2020-21 fund expenditure plan does not utilize the risk assessment methodologies. I think that's really important and critical to note. And then lastly, my last comment is not necessarily, I'm not sure it fits neatly into the 2.0 conversation, but it does go back to what Danielle Coates had brought up earlier about, you know, potentially seeing systems toggle back and forth between at risk, potentially at risk. And, you know, I appreciate the iterative process that the risk assessment is taking and that it will continue to be refined. And so my question is sort of for the program overall and maybe for future white papers, just maybe a footnote or something, or another call out box for how the board staff intend to deal with systems, you know, that receive initial funding and then move along that process to reliability and sustainability, and maintaining that funding stream to ensure that they, you know, become sustainable. And so I think we probably would all hate to see a system, you know, start to move on that trajectory and then move from at risk, then move to potentially at risk, and then to continue to progress and then suddenly like potentially fall off the, you know, the list of fundable projects. So it's just a concern that I have moving forward. So that's all I have. Thank you very much.
Yeah, thanks for sharing that. So can we get like a 30-second response to that really important point, and then we'll wrap up this meeting on time.
Kristen, do you want to take this? Kristen and board staff did all the infographics, so I deserve none of the credit for that, but I'll hand it to Kristen to close.
Yeah, no, if I'm understanding correctly, I do think it is important, and something that we're talking about within the SAFER program is tracking systems over time as they oscillate between these different categories, given the criteria that we have and are developing for, you know, out of compliance human right to water systems, at-risk systems, potentially at-risk systems. what qualifies you for these lists, and then what takes you off of those lists, and what does that mean from a policy or decision-making standpoint within the board. We're still figuring all that out. I think we encourage, again, comments and feedback on this as we start developing our business processes and our methodologies. So I think it's an excellent point you've made. We are thinking about it, but we encourage you to chime in and help us think through it too. I'm not sure if Michelle or Andrew wanted to add anything more to that.
This is Michelle. I guess from a funding standpoint, I will definitely say that we have thought about that as well and are working with DFA, particularly as it applies to consolidations and things like that, to think through if they were, maybe someone got POE and then now is in compliance, we wouldn't want to prevent a consolidation or some sort of other longer term strategy. So yeah, we're definitely thinking about that, and thank you for your comment.
Well, thank you for that. And thank you, Michelle, for being the only one that actually shared your video today. It was nice to see your face on this webinar at the very end. So thanks everybody for sharing and for participating. I do want to invite you to register if you haven't already for the 1 p.m. session. That will be follow-up to this with State Smalls. Registration is still open. It will close at noon. So let us know if you can't make it and register by noon. You can email us at the SAFER website and we'll make sure you get that Zoom link. So again, thank you all for participating and for staff for being here to answer questions in your presentations. And we'll see you later, or we'll see or hear you at 1 p.m. today. Thanks, everybody.